Between the humidity and the heat, you may be dripping in sweat when you're outside. Well, it turns out there's a common procedure that can help. Botox. Yes, you can get Botox in your armpits to reduce sweating. It's actually FDA approved. But is it safe and effective? Well, I'm here with Dr. Bijoor from Oakview Medical Associates in Greenville, and we are fact-checking Botox for sweating. So thank you so much for joining us
You're
today.
welcome. Thank you for having me.
So let's first talk about how does this work? I know people get it. I've actually never heard of it, but I thought it was so interesting.
Yeah, and it's very popular. I've been doing it on patients for years. Basically, botulinum is a chemical that can block the release of a neurotransmitter called acetylcholine at the nerve and muscle junction. So where the nerves feed the muscle to contract, it blocks the release of that chemical. So by doing that, it blocks the nerve signal that releases the sweat from the sweat glands.
So how long does it last once you get it?
Typically, it lasts about 4 to 6 months, but I have patients that come once a year, just pre-summer months, and they're fine with that for the whole year. So,
what are the pros and cons? Like, are there certain people that should not take it?
Yeah, so it's very effective if done correctly by licensed physicians and professionals. Very low risk side effect profile, I would say mild pain. Now it is FDA approved for the underarm sweating, but it's also off-label, used for palms and soles of the feet. So those areas, it can be a little more sensitive and painful, but allergic reactions are very rare. You cannot take it if you are on a certain type of antibiotic called aminoglycosides, which are like gentamicin. But other than that, it's pretty safe. Cannot use it in pregnant or breastfeeding population, and also in people with muscular dystrophies or muscle disorders like myasthenia gravis.
Now, I know sweating actually helps our body cool down.
Yes.
So should you be drinking more water after you have this type of Botox in the armpit?
Yeah, you should. Overall, it's very safe. It doesn't affect your entire body's ability to sweat because it's a very small localized area just to the armpit. So, but you must stay well hydrated, you know, as of course at least 8 glasses of water every few hours if you're outdoors, especially in these summer months.
And make sure to seek some shelter if you're feeling hot.
Stay cool.
Is it ever covered by insurance?
That's a great question. So it is approved by insurance, but it depends on your specific plan. Insurance does require a prior authorization, and it requires you to fail 2 other forms of treatment. So like there's a topical chemical aluminum that we use under the armpits, and then also the oral medication. So if you fail those 2, the doctor has to document that, then submit a request to the insurance. Sometimes it comes back as approved, sometimes it doesn't, but the cost is a big factor. But considering how effective it is over many months, some people still go in for it because it's a quality of life thing. I mean, if you're working out in the summer months and you're excessively drenched in sweat, it's amazing. It's patients that get it done, they love it.
Now, you mentioned 2 other ways to reduce sweating. How does Botox compare to those methods?
I would say I use it on the patients that don't get relief with the other 2. The others are, I mean, mild to moderate cases are fine, but if you're like drenched in sweat and it's excessive, then you have to try this. It's very, very effective.
All right. Well, thank you so much, Dr.
You're
Bijoor,
welcome.
for coming in today and letting us know a little bit about Botox for sweat. Interesting.
Thank you.